Hi, my name is Berre. I'm a research assistant and PhD student working on the Rosa team at McGill University. Rosa team stands for Research on Organization of Healthcare Services for Alzheimer's. And now I'm going to present you the results from our project called Improving Quality of Dementia Care, Insights from Audit and Feedback in Primary Healthcare Practices in Ontario, Canada. So in Ontario, with the aim of improving care for people living with dementia, many primary care practices have implemented various services and models of care based on Canadian dementia care guidelines. The objective of this study was then to describe the reaction of 8 primary care practices in Ontario when presented with their performance data related to dementia care through a process of audit and feedback. So for the audit phase, we collected data from 3 sources. First, we conducted a retrospective chart review to collect data on multiple indicators of quality of follow-up care for dementia. We also used validated questionnaires to measure the knowledge, attitude, and practices of physicians, nurse practitioners, and other healthcare professionals. And finally, we conducted interviews with healthcare professionals and managers to identify barriers and facilitators for the implementation of dementia care services and models in primary care. For the feedback phase, we presented the results of these 3 sources during a focus group at each of the 8 participating sites, for a total of 8 focus groups, including 63 participants, either family physicians, nurses, other healthcare professionals, managers, and decision makers. 4 main questions initially guided the discussion. So which results did you find surprising? What key elements explain these results? What changes in terms of results would you like to see in the future? And what will help you achieve these changes? All the discussions from the focus groups were analyzed through inductive thematic analysis and a deductive-inductive content analysis. Looking at the preliminary results, most participants of the focus group, when discussing their experience with dementia care in their practice in reaction to their audit data, talked about some of the indicators from the chart review results, particularly those around diagnosis, referrals, treatment, and follow-up of dementia. When reflecting on their results, they identified organizational factors and clinician factors impacting their practice, and they offered suggestions for future improvement based on their current needs. In conclusion, with the high acceptance of this approach from the 8 primary care sites from our study, audit and feedback processes do have the potential of improving local clinical practice. Participants identified potential solutions to meet their needs, and exploring these may be the key for the sustainability of the current dementia care services and models in primary care. As such, they may be helpful in guiding provincial and federal dementia policies in the future. Thank you.